I think most of us at some point have looked in the mirror and thought, man, I wish my smile was just better. And you probably think the answer is just those clear plastic trays, right? Well, the real secret, the actual engine driving the whole thing, is something you'll never, ever see. So, let's get into it. It seems like such a simple question, doesn't it? How do you design a perfect smile? But when you really think about it, it's an incredibly complex puzzle. It's part biology, part physics, and yeah, a whole lot of artistry. So, where do you even start?
Well, you start with the end in mind. I mean, look at this. On the left, you've got the starting point, maybe some crowding, a few gaps. And on the right, the final result. That amazing transformation, that's the goal. But the journey from point A to point B, that is where the real magic happens.
Now, we've all seen these. The Invisalign Clear Aligner. It's the physical tool that does the pushing and the pulling. But thinking this is the whole story, that's kind of like thinking a sculptor's chisel is what makes the masterpiece. Nope. The real genius is in the blueprint.
So here's what we're going to do. We're going to pull back the curtain. We'll look at what a smile makeover really is today, then dive into that digital blueprint. We'll talk about the dentist's role as the architect, how you can actually see your future smile, and then how that plan becomes a reality.
All right, let's jump right in. We're going beyond the plastic to see what really powers a modern smile makeover. And here it is, the big secret. The real magic, all the critical work, it all happens in a virtual world long before a single aligner is ever manufactured. Think about that for a second. The entire outcome is basically locked in before the physical treatment even starts. So this brings us to the heart of the whole system, the digital blueprint. It's this incredibly powerful piece of software called Clincheck. So what exactly is Clincheck? Okay, imagine a mission control center for your mouth. It's this cloud-based software that takes a 3D scan of your teeth and lets a doctor map out the exact path for every single tooth, from where it is now to where it needs to be. And the best part? It's not guesswork. It's powered by the data from millions of other successful smile journeys. And hey, don't just take it from me. Listen to Dr. Rother. He says, now, here's what's so important to understand. Even with this crazy powerful software, this is not some automated push a button and you're done process. And that brings us to the most vital part of the equation, the dentist. They are your smile's architect. And this right here is a really crucial point. On one hand, you have doctor-guided treatment. That's when a trained professional does a full health check. Are your gums healthy? Are the bones strong? They create a totally custom plan and manage it every step of the way. On the other hand, you have some direct-to-consumer options that can bypass that expert supervision. And that can be risky, right? Because what if there are underlying issues that nobody catches? So the software doesn't replace the doctor, it puts them in the driver's seat. It gives them this incredibly sophisticated steering wheel and a GPS, but the doctor is the one who's actually driving the car and making all the critical decisions. And what does that driving look like? Well, here's a little peek at the kind of checklist they go through. They're not just looking at making teeth straight. They're asking really important medical questions. Is the final bite actually healthy? Will it be stable for years to come? Are the roots of the teeth angled correctly? They even plan for these tiny little things called attachments that act like handles for the aligners to grab onto for tricky movements. It's a full-on medical procedure. And inside the software, the doctor basically becomes a digital sculptor. They have these amazing 3D controls where they can grab a single tooth on the model and tweak its rotation, its angle, its height, anything. They can drag and drop those attachments we talked about, or even expand the entire arch of teeth. And here's the cool part, they see the ripple effect of every single change instantly. And this feature is a total game changer. It used to be that a doctor would send in their notes for changes and then wait, maybe for weeks, to get a new plan back. Now, they have something called Live Update. They make a change right there on the model, click a button, and then about 2 minutes, a completely new, recalculated treatment plan is ready to go. They can fine-tune and perfect the plan right there with the patient. It's incredible. Okay, so we've seen how the doctor uses this incredible tool, but let's switch gears and focus on the most important person here, you, the patient. How does all this tech make the journey better for you? This is it. This is the #1 question on everybody's mind. It's a huge commitment, right? So you want to know, can I get a sneak peek? Can I see where we're going before we leave the station? And the answer is a big, resounding yes. It's called the Clincheck Smile video, and it's amazing. It takes that 3D final result from the treatment plan and puts it right into a short video of your own face. So you're not just looking at a model of teeth. You're watching yourself talk and laugh and smile with your actual new smile. The whole thing is so simple. Your dentist just takes a quick video of you, and that gets merged with your approved digital plan. The software does the rest, creating this super powerful simulation. It just completely changes the conversation from something abstract to something you can see and feel.
And, as Dr. Chen Jung Lee points out, this isn't just a cool party trick. It's a genuinely valuable tool for getting patients excited and involved. I mean, when you can see the finish line that clearly, you become a real partner in the process. You're way more motivated to make it happen.
So for our last section, let's connect all the dots. How does this perfectly crafted digital blueprint actually become a real-world, healthy, beautiful smile? This is where the digital plan finally meets reality.
What I love about this is that we're looking deeper than just what you see in the mirror. On the left is an X-ray before treatment, and on the right is the X-ray after. And you can see it right there. It's not just that the tops of the teeth are straight. Look at the roots under the gums. They're in healthier, more stable positions. This is proof that the changes are structural, promoting long-term health, not just a pretty facade.
And that really brings it all home. It's about that partnership between the doctor and the technology. Dr. Lee's comment says it all. The system, because it can plan and execute these incredibly precise movements, allowed for a result that just wasn't possible before.
So let's end with this thought. We always say a smile is a work of art. But what does it mean when the artist is a highly trained doctor, the canvas is a dynamic 3D model, and the paintbrush is an algorithm powered by millions of data points? It's this incredible fusion of medicine, technology, and aesthetics, all working together to engineer something perfect. Pretty amazing when you think about it.